In my university days, I was so focused on just getting through all the content and passing all the exams that when I finally got my bachelor's degree, I was like, great, now what? So I did what most other directionless science students did. I signed up for masters. But then I did that and still didn't have much of an idea of what I wanted to be when I grew up. And I still don't really, but that's not you. You're doing EMT because you know you want to be an emergency medical technician and maybe even a paramedic after that. So to suit you up with the best advice on how to transition seamlessly from training to working, I've interviewed Jeralyn Price, a nationally registered and certified paramedic and EMS instructor with 33 plus years experience under her belt. She knows all about the demands of the EMT job market and what you need to do in order to advance your career. So if you want to avoid my rather lengthy meander through academia before you find your dream job, here's Jeri Price's advice on how to get a job as an EMT. All right, let's say that you've just passed the NREMT exams, received your certification, and now you're hitting the job market. Where do EMT graduates start?
I think that's a fantastic moment in their lives.
Yeah.
And I would say the first thing they need to celebrate with their families. And we talk about equipment during the classes, but buy yourself a nice stethoscope. Okay. Some quality equipment that you can hold on to for a long career and a long time. But that being said, different states have different recommendations. So the first thing that went through my head was, that's fantastic. We've got nationally certified. But most of the states are going to require that you become state certified too.
Okay.
So in most of the states, that just means, here with us, it just means filling out some online paperwork, saying that I am nationally registered and that the state will just follow through and issue a state card. Okay. I don't know if EMTs realize they can be certified in multiple states at the same time.
Yeah.
But I would look into, and hopefully the Education Center, the training center has given them that information as far as to complete the whole process for the state. Here where I am in Colorado, it also flags EMS professionals as healthcare providers. So if any illegal activity were to come, specific, let's go with just speeding.
Okay, yeah.
You're speeding and you receive a ticket, as they pull up your license plate and those kind of things, it comes up that you're a healthcare provider in the state. So those things may be flagged for different incidences. It could also be very beneficial depending on where you're at. So,
okay.
It's pretty awesome. But the first thing I would do is check into what the state requirements are. As far as job opportunities, there is so much. I mean, we generally look at an ambulance, like that's everybody's goal, but there's so much more. A lot of the ambulance or the private agencies start off an EMT with what's called a wheelchair car. Okay, where you take patients in their wheelchairs, and it's a little van, and you roll them up in the van, you take them to doctor's appointments and back to their houses or whatever. What's fantastic about that learning curve is mapping. They get to know the city, right? They get to know where the nursing homes, the assisted livings, the dialysis centers. There's so much they get to know. Radio communications, how to talk to their dispatchers, communications with the patients, and that is phenomenal to have, developing that skill as far as comfort level and how to speak to them. So that's a massive jump right there. It's not what everybody wants, because it's, it's not the 911 lights and sirens kind of thing, but it's a phenomenal experience and it's a great learning curve. Okay. So that they can go to work in doctors' offices. My daughter was an EMT for a while. She actually went to work in an equestrian center.
What?
So for the riders, to provide care. Yeah, urgent cares, the hospitals, they don't have to work in an emergency room. They can go up to one of the floors and work with pediatrics, whatever. So yeah, once they have those skills to don't just close mind and think it has to be an ambulance service, because it doesn't.
You'll get there.
Anything a medical assistant can do, an EMT can do to a different level, right? Depending on the states too, they can look into becoming IV approved. So they can start IVs. Some states allow EMTs to do that, some states don't. But they can look into it and see if that's another opportunity for their classes. They can start studying basic EKG interpretation, how to read an electrocardiogram, and what that means, right? What medications can be given. And it's so amazing to go through that process and figure out what those little bumps and squiggles are and where they're coming from. But to take that information, anything that they're doing is only going to make that facility where they're applying at to look at them maybe a little bit, get a little bit more qualification. And I think that drive, and again, going back to curiosity, that drive of just the insatiable, I need the knowledge and I want to know why. But there are so many, going back to the jobs, I can't think of a medical place that would not hire an EMT.
Yeah. There's like also the civilian and there's government, military. Well, there are EMTs in the military, right? They work with paramedics.
Yeah, when they go into the military for medic training, they do the same. It's a national registry process.
Yeah, right.
So the Marines go through the same education process. I would imagine it's a little bit different, a little more militant, but those government agencies or those militaries do the same education that we're doing outside of them. Science
vessels, oil rigs. I mean, sky's the limit. Whatever interests you. Yeah. You know, be a first responder in that environment.
Absolutely. And do you go onto a boat, a fishing vessel, or oil, or you go overseas in a rescue, or you go to some very rural, what am I thinking, deep dark forest someplace? The EMTs have become the medical authorities because they're the only ones that are so far out there. So I would say your imagination and your passport, it's endless on where you can go.
Right. So what does the job hiring process look like? You just walk into a hospital or a healthcare facility and say, hey, I'm an EMT, you know, walk me through.
I wish it were like that. That was like the old days when we could just go in and go, can I fill out an application? Yeah. And I'd be like, yes, here it is. Probably not any longer. So, if there's an agency, if there's a facility, if there's someplace you want to work, you've got to go onto their website, basically, and look for, obviously, their human resource departments, if they have jobs posted. A lot of times it's not uncommon in a hospital setting that the EMTs, we have transport technicians, that the EMTs will apply in a hospital setting to become a transport tech, which means if somebody in the emergency room is going to be moved up to the 6th floor, they have the transport tech come down, move their bed, all of the equipment up to the 6th floor, and they're responsible for that patient until they get up to the next floor. But when a position opens up in the emergency department, they're already recognizable, they've already seen their work ethic, they're already security cleared and all that other stuff. So to bump that EMT into that position is a given, basically, depending on how their work's been going. So online, if they wanted to volunteer, a lot of the volunteer agencies too, which is a fantastic experience, really is a fantastic experience. And to be able to have that on a resume is another fantastic experience. But we'd still have to probably go onto their websites. I would say in that circumstance, I'd probably be more willing to follow up with a visit too, if that would be okay with the agencies. COVID has kind of closed the doors to a lot of just impromptu visits, but maybe schedule. Can I have a tour of the facility? Would that be okay? And they again can volunteer in hospitals. Children's Hospital out here is massive, and they can go to work as a volunteer. Again, it gets them into the light. It gets them into those personnel and networking with the ED staff or the 6th floor staff, whoever. Is that now we have a familiar face, and I'd be more apt to bring that onto our team than a stranger.
So it's all about getting a foot in the door by showing up, being visible, networking, you know, even before you're actually earning an income to volunteer, and super valuable experience.
A lot of the volunteer agencies too will take them to the next level. They may provide money for schooling. They may offer, one out here specifically comes to mind, that they offer firefighter 1 and firefighter 2 training. So they already have that certificate as an EMT working into a fire agency. Very helpful to have that job.
Okay. Tell me, what are prospective employees looking for in a good job candidate?
A great attitude. Which again, I know is tough in this day and age, but again, somebody that is on time. And it sounds silly, but EMS is always on time. On time is late. So if your shift starts at 8 and you show up at 5 minutes to, you're late. And if we look at, if I'm relieving another EMT, that if I'm not there at least 30 minutes before my shift starts, and at 5 minutes to 8 when my shift ends and their shift starts and they show up, but I got sent out at a call at 10 minutes to 8, I may be out running calls until they can get me back to where my relief is. So to be responsible, to be accountable, there's a huge integrity is such a huge thing, to be able to talk the talk and walk the walk, and I believe having that expectation in the other people that you work with as well. So they have to be compassionate, they have to show that they're communicative and that they know how to communicate with texting and that kind of stuff. It's you can't do that. Can't do that. And EMS agencies cross state lines, so it's not surprising maybe that you have an 8-hour transport with a patient. What are you going to say to them? So how do you continue that? And a lot of times in those distance transfers, they want to sleep, but which is fine. But having those communication skills effectively. So if there is, I know Brainscape has flashcards in communication, as well as the colleges offer, communication, public speaking, that kind of stuff, to help gain their confidence. As well as people are very intimidated by, I'm going to be speaking to a doctor. It's like, go meet those people, go put yourself in front of them, so that when we actually do call in for an order to say I need to give nitroglycerin, that physician's like, oh, I remember you. Right? I remember you, that's right, we had that conversation in the hallway. So anyways, so much of it is just having a positive attitude, and in all honesty, EMS is a slow culture to change, and sometimes people get beat down very quickly. But to resist that, to really put, these are my idealistic students for the future. They are the future of EMS, and to have a great attitude and be able to talk to the little old lady that's just scared and just really wants somebody to talk to and go to the hospital, and be okay with that. There's some really tough questions that we have to ask on occasion, and I wouldn't say we're ever comfortable with them. But we have to practice those skills as well. And I'm sure when you said, what are they looking for? I'm all over the place as far as answering your question. But interview skills, if you have an opportunity to have somebody, usually these are panel interviews. So I'll go back to that. Usually they're panel interviews. It could include their medical director, could include just a couple of the staff members, but be able to answer those questions and have a thoughtful and a conscious presence, to not be shy or withdrawn, but to have a presence and prepare for that so that you can address each member of the panel. Some agencies might ask you, or agencies or facilities might ask you to take a quick exam on what your knowledge basis is. I know in ambulance services, they actually will give you mapping tests, so you know where to go in the city, even with GPS. But anything you can think of that could prepare you. Again, I know it sounds ridiculous, but standing in front of a mirror and speaking articulately, whatever your answer is, your parents will drill you, I'm sure.
Why not?
If you know somebody that works at a fire department, or you know somebody that's a nurse in a hospital, sit down with them. What kind of things are they going to ask me?
And you know what, I like that you talked a lot about the so-called soft skills of communication and being likable and being respectful and on time. These are not skills that I feel these are skills that are slipping from the newer and newer generations, especially the on-time one drives me nuts. I once went to a birthday party and I was on time, and every other guest was an hour late, including the birthday girl herself. So I am pretty old school in terms of.
Good for you.
Good for me, I know, right?
Here, throw your own party.
It's just really important. And also, like, considering a lot of the EMT graduates that are going into the job market are fairly young, it's a huge transition from being a student and in essentially, being a young person to suddenly be, being exposed to all of this trauma, and people who are terrified, and old ladies who are scared, and young people who are in car accidents, and it's just a lot. It's a whole lot. So those soft skills really need to be worked on, and for you to take time.
Well, and just to add on to that, they need to have a self-care practice in place. So I don't know a lot of the schools that actually teach it, but a support system that we don't cause secondary trauma to, but to have other skills in place. And I think, again, with this new generation, that they have those things, but I don't think they realize how beneficial that's going to be in EMS and in prolonging their career, decreasing, the downside of depression, those kind of things, that to have some of those things in place and to think about them in advance.
Yeah.
But not also just to think about them, but to actually make time and do them.
Daily practice.
Whether it be yoga, whether it be meditation, singing in a choir, any of those things.
I like that.
But to have something in place for those times, because it does get dark on occasion.
Yeah. Okay, so moving along, aside from studying hard and practicing your emergency care skills to perfection, is there anything else an EMT in training can do while still in school to advance their chances of getting a good job? I guess like volunteer work. Oh, sorry, go ahead.
It's depending on the length of the EMT class that they've taken. So for 4 years, I taught EMT 8 hours a day, 5 days a week for 6 weeks.
Wow.
Yeah, there was no time to read. It was so over. You can have an EMT class over 6 months or a semester. Mm-hmm. So depending on that, but if we don't recommend typically that, because of the amount of information we're giving, that they take other courses, but depending on the length of their course, to take other courses, to take communication, to take basic math at an EMT level. There's some basic math involved and pharmacology. So anatomy and physiology, kind of an intro class to it, because at a paramedic level, they're going to require that you take college level anatomy and physiology. And it only helps you understand the pathophysiology of what's going on with your patient better. So to do that, if they can volunteer, if they can volunteer at a daycare center, or go in and work there, because then the anxiety that we carry around at EMS about children, and fortunately children are commonly healthy, so we don't deal with them often, which causes a huge amount of anxiety. So if I expose myself to them frequently, hopefully my anxiety level will drop down a little bit, and I'll be able to be more attentive to what the child needs or patient. Go work in a nursing home. Go volunteer to go take vital signs in a nursing home. And set up your Girl Scout booth outside of the local grocery mart. Get creative. There's just anything is good if you're working toward becoming excellent at your skill.
Even just putting yourself in a place where you're forced to interact and talk to people, even if it's not in a medical setting, just getting comfortable talking to strangers and dealing with people could be a valuable experience.
There's a process of history taking when we're talking to a patient. That's the OPQRST mnemonic, and it talks about onset and provocation and radiation, severity of your pain or discomfort, and then the time frame involved. And I would go to my students and I'd pick one, and we'd just sit and have a conversation about whatever's going on in his life, and then talk to the rest of the class and say, what did we just do? And I could go back to and put up on the whiteboard that this was his onset with the situation, this was the provocation, and to go through it and go, it's simply a conversation. And people want to tell you their problems if you give them an opportunity. So part of their assignment would be to go out into the general public and just start a conversation with somebody, not about medical, but to have a conversation. And they would come back with some phenomenal experiences about meeting the vet at Kmart or Walmart, and what stories that he just wanted to talk and somebody to listen. So, and that's such a fantastic feeling in itself. But to develop those skills, you have to practice. I've never had a problem communicating with anybody. So, but I'm also very conscious that other people do.
Yeah. All right. So what's an approximate starting point salary for a new EMT?
I loved that question. But it's also so dependent on where you're at. Hospitals will pay more than ambulance services, most likely. Fire agencies versus private ambulance services will probably pay more. But depending on where you're at, is probably going to depend on what your pay is. They are working toward in EMS as well as in fire agencies to become more science career oriented. So they're working toward bachelor's degrees, that you're going to have to get a bachelor's before you can. There are associate programs. You can get an associate's degree in EMT or paramedicine. But just know that that's what's coming, and you probably just need to be working toward that.
Do you have a ballpark figure for the state of Colorado, which is where you're at?
Yeah, unfortunately, $12 to $18 an hour for an EMT.
Okay.
And I would say the $18 an hour is probably in a hospital.
Okay.
Not in an ambulance.
Yeah. All right.
And this is horrible. We always talked about, do the time before the wine kind of thing. Like we all did our time, but I really believe that for this to be the profession that it is, and it's such a young profession, that we have to up our game individually and say, I have this education, I have this knowledge, I have these experiences, which is hard when you're 19.
Mm-hmm.
But to pursue that and to up the level of the career and the expectation as well as the respect level of the career. Yeah. And COVID did a lot for us, but there's still more to be done to be taken seriously. And once this career is, I think, taken at a professional critical level, the pay is going to come up with it.
Yeah, right. I really hope it does. Okay, so as new MTs embark upon their careers and gain experience, what additional training or certifications would be a good idea to add to their repertoire?
Initially, when I saw this question, I'm like, teach. was if they have an opportunity, American Heart Association, to become a CPR certified instructor.
Okay.
Right. Yeah. The only thing that teaching will do for them is that they have to know the information to relay it effectively. So that is a great opportunity if you can pick up, and again, volunteering. How many times have we said this? Wherever that's at, get out there and volunteer. Get out there and volunteer for community activities.
Yeah.
This is silly, but we have a zombie crawl every year downtown. And the zombie, it's fantastic. And we compete with Seattle, like who's got the biggest one.
Yeah.
So it's been fantastic, but I called the organizers a couple of years ago and said, I'm taking an EMT class down here. They have specific assignments that they had to find a zombie with a head injury or a zombie with a spine injury or all these things. And the organizers were so excited, like we already have our medical response team, but have them check in with us because the more the merrier. And because the way these people are dressed, you don't know who's what, if they're really injured or they're not.
Oh my God.
So the more EMTs we can get out here, that's awesome. So, and they came back with just amazing photos and stories of traumatic injuries to these patients. So anything, just like I said, get out of the box, think creatively. People are more than happy to accept help, especially when it's free.
Okay. Cool. Trying to find the real blood amongst the fake blood of the zombie.
There's some intense.
So funny. Okay, so tell me, what are some of your best tips for new EMTs who are on the hunt for a job, aside from many of the things you've mentioned? Anything else that stand out for you?
Don't give up.
Oh, yeah.
Don't give up. You may be hired by one agency and holding out for the next one, and that's okay. Mm-hmm. A lot of, if we're looking at private ambulance agencies, that's what they expect. They know that they're stepping stones to the next big thing. Yeah. The agencies that say, or the hospitals, doctors' offices that say experience required, it's like they all know somebody has to start somewhere. Yeah. But in looking at it, don't give up, don't get dissuaded, keep trying, it'll happen. Because that's the mentality of the EMT that I want. That if I'm sick or my children or my grandchildren are sick, is the EMT that doesn't give up, that doesn't get knocked down, that doesn't, and I get for a little bit, I get getting knocked down for a little bit, but you got to get back up and try it because it's an amazing career. Yeah. It's an amazing job to do. Wow. So.
Okay. Tell me finally, how can EMTs remain abreast of new developments and ongoing training requirements so that their knowledge is always up to date?
Right. Hospitals offer continuing education all the time. Yeah. The agencies that they work for should and do offer continuing education through their medical directors. Mm-hmm. State conferences, hospital conferences, there's EMS conferences for all of the states, right? They all have their own to whatever level or degree they have them. Children's Hospital is a specialty hospital out here. They're constantly offering conferences. Aeromedical conferences. There's just hundreds of opportunities. It's just finding them, getting into the websites, getting into those agencies. The fire agencies have them. There's always free ones. There's also paid ones. Certificate programs. I think I mentioned that earlier, American Heart Association, but there's also pre-hospital trauma life support. There's advanced cardiac life support that the EMTs can attend, but they can't be certified in them. Okay. If that makes sense. But it's additional in their knowledge. Like I did attend a PHTLS class. Yeah, right. Yeah. I attended it, and that's good. that's showing that they're willing to go to the next level to challenge themselves, which is awesome.
Yeah.
But yeah, there's always opportunities out there. Yeah.
Pursue your curiosity.
Mm-hmm.
Yeah. Well, there you have it. How to get a job as an EMT, with tons of great advice on accelerating your career trajectory by developing the right skills and even attitude. So all that's left to say from the team here at Brainscape is that we wish you the very best on your job hunt and thank you in advance for your service. If you're in EMT school and preparing to take the NREMT certification exam, you've got to get Brainscape certified EMT flashcards in your corner. This collection contains 10 decks and a total of more than 500 adaptive flashcards that are designed to drill you on the key concepts that will likely show up on exam day. With the curriculum condensed down to a super efficient flashcard format, you can use Brainscape anytime, anywhere, and on any device to study more efficiently with spaced repetition. Brainscape also has an EMT Academy packed with helpful guides on topics that range from what you can expect from EMT school and how to study more efficiently, to the difference between an EMT and a paramedic and how to get the best jobs. So grab the tools Brainscape has for you, study hard, and rise to the challenge of emergency medicine.